Good day, Miss Marini. Today my groupmates and I will be presenting on legal liability of medical practitioner refusing to treat patient during a pandemic. I, Savita Rajaraman, will be presenting on current state of Malaysia, role of private healthcare, refusal to treat and when can refuse a treatment. The coronavirus disease 2019 COVID-19 pandemic caused by severe acute respiratory syndrome coronavirus 2 SARS-CoV-2 has resulted in an international public health emergency and created extraordinary ethical challenges towards the response in handling the situation. The current state in Malaysia is critical due to the spread and outbreak of COVID-19 epidemic. The government has taken drastic measures in reaction to significant spike in cases and death, enacting the countrywide movement restriction order and the National Recovery Plan. This has persuaded individual healthcare providers to expand their responsibility to include the monitoring of suspected or COVID-19 victim in the role. Through the Prevention Control of Infectious Disease Act 1988, MOH Malaysia has adopted an emergency ordinance to instruct private hospitals to receive COVID-19 and non-COVID-19 patients to reduce the strain of public facilities. The treatment of COVID-19 patients at private hospital could help to boost the bed and critical care occupancy. For example, KPJ Healthcare Berhad, one of the largest private hospital group in Malaysia, immediately took heed of the government's instruction and started receiving both COVID-19 and non-COVID-19 patients from public facility in January 2021. Not only are the private hospital treating COVID-19 patients, but non-COVID-19 patients can also be channeled to them to ease the burden on public hospitals. A fine or jail time could be imposed if private hospital refuse to receive category 1 and 2 COVID-19 patients under the emergency ordinance. The question arises as to what about the other private hospital? Do they or can they refuse to accept COVID patients who come to them and there is any impact on the refusal? In the event of pandemic, healthcare professionals must strike a balance between competing obligations such as patient care and individual safety. Healthcare workers must wear full PPE during high-risk procedures like intubation or treatment. It is to be noted as doctors, they have responsibility to treat patients, but before that, they got to take good care of themselves by minimizing their risk of exposure. Patients may be less affected if adequate preparation and training are done ahead of time. It's a safer encounter than, example, evaluating a patient with breathing issues. All that is needed in good hand cleanliness and the use of adequate protective shield, for example, mask, face shield and apron. Although conscious opposition protects moral integrity, it may risk treatment if no prior preparation or transfer of care is in place. During a pandemic, conscious opposition may be necessary for value-laden triaging procedures, but it has no influence on underlying need to care. In an emergency or when a certain therapy is unavailable elsewhere, such as in the case of pandemic outbreak, healthcare practitioners cannot refuse to treat patients. Healthcare providers can quickly benefit from scientific information and other people's practical experience in the event of an unusual and unplanned infection. They have moral commitment to serve to the best of their skill when the public's life is in danger. It is a moral duty to help who are in need, said by Lord Coleridge in R. and Instant 1893. It would not be correct to say that every moral obligation involves a legal duty, but every legal duty is founded on a moral obligation. If the doctor realizes that patient might be affected by his act, then it's automatically established the neighbor principle where duty of care arises from the doctor-patient relationship. There is also a duty to emergency patient. The common law does not impose an favorable duty on a doctor to attend a person who is unwell or even in an emergency. If the doctor is not and has never been in professional connection with that individual, If a doctor works in a casualty or emergency department, he or she may be required to do a duty. Breach of statutory duty will also occur if a registered medical practitioner refuses or fails without reasonable cause to attend on a person for the purpose of rendering professional services in the capacity of registered medical practitioner in any case where the practitioner has reasonable cause to believe that the person requires immediate attention by a registered medical practitioner. Breach of duty during pandemic also will be when failure to follow a standard operating procedure and guidelines set in place by relevant authority, and also failure to follow the accepted practice in the field of specialization you are. Doctor's negligence also may have severe consequences not only to his patient, but others as well this duty to third party. In certain circumstances, the doctor may owe duty to person other than his patient, those coming within the neighbor principle, formulated by the Lord Atkin in Donahue and Stevenson. For an example, in a COVID emergency situation, if the third party in danger from an infectious disease by coming into contact with the patient, whereas in English common law, there is no legal obligation on a doctor to play a good Samaritan, render assistance to a stranger. A doctor has the ability to refuse treatment to a patient who uses threatening language or acts violently towards the doctor or staff and refuse to adjust his behavior despite repeated attempt to redirect him. If a severely sick patient who appears in the emergency room display aggressive behavior but in desperate need of care cannot be ignored, since she will be put in danger right away. But at the same time, pandemic is not a license to act negligently by refusing to treat the patient. If this happens, then there may exist a clear breach of duty.
Hi, Ms. Manini. I'm Dr. Muhammad Hafiz bin Abdul Razak. I'll talk about our topic of research, to evaluate the legal liabilities of medical practitioners refusing to treat patients during a pandemic under the law of Malaysia, as well as other common law jurisdictions like England and Wales and Canada. So I'll focusing more on England and Wales. So as we know, during a pandemic, it's a very tough time, and all the medical practitioners, especially doctors, are working under extreme pressure. So in order to cope with the extreme pressure and the hard time, the UK government suggesting the doctors who are already retired are returning back to practice, and the final year medical students are being fast-tracked into the front lines roles. This is because the resources are becoming increasingly restricted and the choices of available care are very limited. So, example is COVID-19 is creating the significant personal and economic disruption and loss. This outbreak or pandemic, it may last several years and giving sustained pressure. So, how about the medical practitioner who are refusing to treat patients during pandemic? When does a duty of care actually arise? According to obiter dictum of Brett M.R. in Heaven versus Pender in 1983, led to a formulation of the Nebel principle. The Nebel principle said that whenever one person is by circumstances placed in such a position with regard to another, that everyone of ordinary sense who did not think and would at once recognize that if he did use ordinary care and skill in his own conduct with regard to those circumstances, he would cause danger or injury to the person or property of the other. The duty arises to use ordinary care and skill to avoid such danger. So in this case, doctors' ability is to help and moral obligation to do so make them vulnerable to expectation of the society. According to the Hippocratic Oath, the medical profession swear that stated that act so as to preserve the finest tradition of my calling and experience the joy of healing those who seek my help. Lord Atkin in Donat formulated a general principle for determining the existence of duty of care, which comes to be known as Nebel's principle. the rule that you are to love the neighbor becomes in law, you must not injure your neighbor, and the lawyer's question actually asking that who is my neighbor, then you must take reasonable care to avoid acts or omission in which you can reasonably foresee would be likely to injure your neighbor. Who then, in the law, is my neighbor? The answer seems to be person who are so closely and directly affected by my act that I ought reasonably to have them in contemplation as being so affected when I am directing my mind to the acts or commission which are called in question. So in this law stated that according to the neighbor principle, the people or the society that if the doctors refusing to treat them or people are affected according to the neighbor principle. The other one is Good Samaritan law. Actually, usually refers to the parable of the Good Samaritan, a story in the Christian Gospel of Luke that encourage people to help others that are in danger. Stated that a compassionate person who unselfishly help others, especially strangers, a person who voluntarily gives help to those in distress or need. It is a moral duty to help those who are in need, according to Lord Coleridge in our verses instant in 1893. It would not be correct to say that every moral obligation involved legal duty, but every legal duty is founded on a moral obligation. So, medical practitioners or doctors form an essential part of the effective response to the pandemic, especially during COVID-19 that currently we are facing. But previously, previously during SARS pandemic, they actually have a critical roles in diagnosis, the containment of the disease, treatment, and we need their commitment to treat despite increasing the personal risk. Um, all the doctor or medical practitioner that working as a frontliners have been experiencing high work volume. They also facing the personal risk and the societal pressure to the extraordinary demands for the healthcare. Actually, the doctors also have the right for their protection. So, the British National Health Service, the NHS, um, um, arise for question. Question number one: what is the nature and the scope of the duties of the healthcare providers? Number two: to whom do they to these duties apply? Number three: what reciprocal obligation to doctors exist from the employment and patients? Number four: what should doctors do when these reciprocal obligations are not met? For those the NHS said that doctors have more stringent obligation of beneficence because the doctors have a special skills possessed by them as healthcare professionals. The social contract between healthcare professional and the society in which they work, actually the doctor have a duty to work regardless of the circumstance. However, doctors have the right for protection and to care during pandemic. Doctor also subjected to risk of illness, risk of death, fatigue from extended hours, moral distress, potential legal and professional risk when they are asked to work at their limits. So, to answer the question, do the doctors have a duty to treat in disease outbreak and pandemic? Yes, they have uh, the the duty to treat during outbreaks or pandemic. Because other than the other person who are non-medical personnel, which they don't have obligation.
A very good day to everyone. I'm Dr. Gabriel. Today I'll be presenting to you in terms of another point of view and help you to evaluate legal liability of a medical practitioner if he or she is refusing to treat a patient during COVID-19 pandemic era. So I think it's quite commonly we can see that some private hospital and private clinics that refuse to accept COVID-19 patients because they're afraid they themselves get infected by COVID-19 viruses. As you know, it is something very, very contagious. So in that sense, whether that particular patient has the right to sue the hospital or sue the doctor because of the medical consequences due to the delay of treatment in that sense. So I'll be presenting to you regarding Canada point of view, and before that we need to have a look about Canada legal framework. So Canada basically is practicing federal systems, which means that the parliament as well as the state government, they both have the power to make law. So why is it important? Because it will come to, I will further analyze to you in my subsequent speech. So whenever we look for medical negligence, we need to establish first whether you have a duty of care, you as a doctor have a duty of care towards that particular person. So based on traditional point of view, a physician only owns the duty of care to their patients, which means that if the person is not registered under your clinic or registered under your hospital yet, that person is not your patient yet, and you don't own any duty of care towards that particular person. Which means that, for example, if someone which has COVID-19 come to your hospital, but he hasn't registered under your hospital yet, he is not your patient in that sense, you don't own the duty of care towards that particular patient, of that particular person, sorry. So in another example, basically, for example, your friends is asking you advice via social media regarding what should he or she eat in order to get better health care and something like that. So in that sense, because that person is not registered under your clinic or hospital yet, so he is not considered your patient, you don't own the duty of care if there's any medical consequences arise after that. However, it's quite different whenever we come to Quebec, which is a state in Canada. So Quebec basically is practicing Good Samaritan law, which means that a legislation that states that every person must come to the aid of anyone whose life is in peril unless it will put his or her life or another life is in jeopardy. So I think if you read Bible, you know what Good Samaritan is. Good Samaritan basically is someone that treating another person or helping another person with purely good-hearted and without wish for anything in return. So in that sense, if whenever we talk about Good Samaritan law, it means that whenever someone comes to you in emergency situation, you must help that particular person. So for example, if a COVID-19 patient comes to you and then you know that that particular person is severely in respiratory distress, or what we say is the person is severely shortness of breath, and without giving him or her immediate airway support, you know that that particular person is going to die soon. So in that sense, you have to treat that person despite that he or she is not registered under your clinic or hospital yet. However, whenever we come across to Good Samaritan law, a lot of people are afraid after they help that particular person, and then that person is suffering some other medical injuries after the help, whether he or she will be liable in that sense. So basically, as long as you are helping in the emergency situations, you are considered protected under Good Samaritan legislations in Canada. So which means that if a COVID-19 patients come to you in some emergency situations, you have to help if you are in Quebec, which is in Canada, this particular state in Canada. So you have to provide the help in that sense, despite he is not your patient yet. And then you don't need to worry in that sense. You might cause some injury to that particular patient when you're helping her, because you are protected under Good Samaritan legislations. Basically, medical negligence or only can be counted in that situation if it is a very gross negligence being conducted by that particular doctor. So according to Canadian Code of Ethics, it mentions that physicians basically have the fundamental ethical responsibility to consider first the well-being of the patients. But if you notice here, it also mentions that it's also quite important for physicians to promote and maintain their own health and well-being as well. So it comes across to the question that the physician basically, besides need to treat a particular patient, he himself also need to consider his own health conditions, which is quite relating to current COVID-19 situation right now. So whether a physician they have the right to refuse to come to work because they're afraid that they themselves will get infected by COVID-19 patients. So we will further look into that questions in the subsequent slide. So basically in this slide you can see different parts of Canada and then different kind of legislation listed based on the state legislations. Government basically authorized the power for the medical practitioner to practice in that situations. For example, based on British Columbia, the Emergency Program Act, the government basically authorized or require any person to render assistance of a type that the person is qualified to provide or that otherwise is or may be required to prevent, respond or alleviate the effect of the emergency or disaster. So in that sense, basically you can just refer to this diagram and then it shows to you different states in Canada what kind of act is used, and in the emergency pandemic situations whether you need to help COVID-19 patients whenever it comes to emergency situations. Like come back to our question just now, we mentioned about if you are the physicians, you think that your health is being jeopardized in that situation, whether you can choose not to come to the hospital or to the clinic to treat patient per se. So those are criteria that basically listed if by Canada if you refuse to work. So basically you need to fulfill all these four criteria in order for you to justify and say, okay fine, I don't want to come to work because of these things. The first point is basically the workers must honestly believe that their health or well-being is in danger. They cannot refuse to work for a reason which is unrelated to safety per se. Which, for example, if the clinic or hospital never provide you adequate protection towards COVID-19 virus, in that sense, yes, you can refuse to come to work. Because you always need to remember the Code of Ethics of Canada, which I mentioned just now. Besides treating a patient, you always need to promote your own well-being and health condition at that circumstance. So if you cannot protect yourself in that conditions, basically you can choose not to come to work because you know that your own health or well-being has been jeopardized in that situation. The second point is the workers must reasonably believe that their health or well-being is in danger. There is another worker with the same training and experience who also believe that the circumstances represent unacceptable hazards. So, for example, if you come to work, you feel that the PPE, the personal protective equipment, are not enough. But it is not for you per se. Basically, your colleagues, which are the same as you as a medical professional, they also need to think as such that the personal protective equipments are not actually adequate enough to protect you guys from COVID-19 infections. So in that conditions, you think that your health is in danger and then you don't want to come to work, then it's justified. Number 3, workers must communicate their concept to their supervisor in a reasonable and adequate manner. So this usually requires the workers to notify to their superior they refuse to work and so on. Which means that if you are working in a hospital per se, you need to inform the your superior consultants or someone who is in the management level so that they can get a notice and then arrange for the person that replaced you in that sense, or maybe they can arrange for further betterment in the future to make sure that your health being is being protected whenever you are treating a patient. Alright. Number 4, the danger must be sufficiently serious to justify the actions. It must be immediate and more than a matter of unpleasantness or fear of minor injuries, which means that the injuries or the consequences that you are afraid to get basically is a consequence which is very life-threatening or very serious to you. For example, in COVID-19, I think it is something that very serious, and then you can see a lot of people die because of COVID-19 viruses. So in that sense, if your hospital doesn't provide you adequate personal protective equipment, you yourself and then your colleagues also feel that this situation is not safe for you to work, and you already inform your supervisor, yes, you can choose not to come to work and treat the patients. So all in all, basically in terms of Canada point of view, you need to treat that particular patient whenever it comes to emergency situation, you think that it is emergency, even though that person is not registered as your patient yet, you have to treat him or her immediately. So you don't need to afraid that after you treat that person and then causing some medical consequences after that, because you are protected under Good Samaritan law, unless you conduct some very gross medical negligence in that sense. So in what kind of condition basically you can refuse to come to work? These are the criteria that you need to fulfill. If you say that I don't want to come to work, I don't want to treat COVID-19 patients, and if you're able to fulfill these 4 criteria, yes, you are actually allowed not to come to work until the condition is safe enough for you to practice medicines or to save patients in that sense. So after that, I will be passed over the subsequent presentation to my friend. Thank you.
My name is Marini. My name is Lee Min. I'm going to critiques regarding the legal liability of medical practitioners refusing to treat patients during the pandemic under Malaysia and England of Wales and also Canada commons law. So since the 2003 SARS epidemic had also provided us some important insight into the experience and also pressure on the medical practitioners during the crisis, as well as highlighting some of the important gaps in the ethical thinking and practice, especially the ongoing pandemic crisis like coronavirus 19. Many of those who treated the patients with SARS previously raised their concern about the protections that were supposed to be provided to safeguard their own health and also their family members. Besides that, some of the medical practitioners refused to even attend to work in clinical areas, which resulting in permanent dismissal, unfortunately, and some of them even chose to leave the profession post-pandemic. So notably, it was recognized that since SARS itself, that there is no agreement as to how clearly and stringently the requirement for the duty to care should be specific. However, this is still turned out to be a grave failing, as almost 2 decades later, which is the time for the occurrence of disaster like COVID-19, there still remains very little consensus and clarity over the reasonable expectations on the medical workforce, especially on the road to these sensitive issues such as refusal of medical practitioners to carry out their duties during the pandemic crisis. So the analysis of the Canadian Medical Association Journal 2010 has shown to us, as accordance to the Occupational Health and Safety Statute of each province in Canada, medical practitioners have the legal rights to actually refuse to work only if they can satisfy these 4 criteria defined by their labour boards. So with certain limitations set by depending on the circumstances and the provinces in which the person is actually practicing. As the hospital and also the healthcare facilities in Canada are governed by the Occupational Health and Safety Statutes in each province, so the provisions for the rights to refuse to work due to hazards are slightly different from each province. So this legislation concurs over the other legislation for the hazards are during the emergency are slightly different. So, to accuse yourself from working under hazardous condition, criteria for justifying a refusal to work must be affirmed accordingly. So, as accordance to the Part 2 of Canada Labour Code, Occupational Health and Safety, for the rights to refuse dangerous work, for example, for these 2 criteria mentioned as below. So, workers must honestly believe that their health or well-being is endangered. They cannot refuse to work for a reason unrelated to safety. So there is another workers which same training and experience would also believe that the circumstances represents an unacceptable hazard. With these 2 criteria mentioned, insufficient supply of protective personal equipment, PPE, during the epidemic crisis like COVID-19, which resulted of refusal of professionals in providing services to the society look as if acceptable in Canada. So it is well form-fitting with another criteria too, as per se. The danger must be sufficiently serious to justify the action. It must be immediate and more than a matter of repugnancy, unpleasantness, and also fear of minor injury. Therefore, only when the life of medical practitioners is threatened with practical reasons, the refusal is acceptable and admissible in Canada. For example, the standard safety equipment is malfunctioning, lacking, or the prevailing of recognized practice in the new context forms an impending danger or risk to them. So all these are the critics from the Canada side. So whereby in UK, there is legislation and statutory established in relation to the occurrence of the pandemic crisis, Coronavirus Act 2020 and also Civil Contingency Act 2004. Unfortunately, the government announced this statutory to be only applied within the time frame announced during the emergency necessarily. In fact, they chose not to use this power within these statutories to legislate, instead still stick to the earlier statutories, which is the Public Health Act 1984, with the consideration of customary parliamentary monitoring, approval and also process. Although this probably designed to be used during the emergency and also contain enough defense to make certain with the accessibility of scope and also action can be taken by the government, which are particularly important when human rights and also human lives are involved on such a massive scale. But matters related to deeper aspects such as the obligations of medical practitioners in terms providing and also refusing care to patients during the pandemic crisis is still lacking from UK. Similarly, when we switch the directions back to Malaysia, there are no specific legal legislation in Malaysia mentioned pertaining to this issue neither. The Applications of Prevention and Control of Infectious Disease Act 1988, Amendment 2020, and movement control, MCO, and corresponding restriction are prior to only for outbreak control. So for example, what does all these statutories do is like for infected persons, close contact tracing, disinfecting the infected area, arrangements of lifting the MCO purpose, and many more. Let's come to the recommendations part. The refusal to care based on health and safety hazards has created most of the dilemmas amongst the medical practitioners, especially during the pandemic of COVID-19. Hence, to achieve an equilibrium during this pandemic crisis, legal obligations with better recommendations are seriously required to safeguard them during the crisis period. In terms of legal liability, most of the researchers recommended that advanced planning with local and national professional medical associations in order to obtain an agreement about the extent of professionals' obligations in a pandemic is crucial. So this should include the development of vibrant and also clear cuts of guidelines regarding the professional rights and also the responsibility. And then other than that, the ethical duties and also the obligations of the healthcare professionals during such an outbreak is also mandatory. So besides under certain special circumstances, the government needs to do some adjustments as well, especially on the standards of care, which may have to be done accordingly. So, and the legal ramifications of these adjusted standards need to be addressed clearly as well during the crisis. For example, the duty of care for the doctors and nurses who work in different specialties. Okay, for your information, an intensely unwell and also infectious patients might not be within the normal range of practice for some of the specialties. For example, from the normal wards, clinics, and also from the daycare unit, and also some other units. So however, to abide by the General Medical Council's good medical practice in UK, for example, as per se, doctors must not refuse to treat patients just because of their medical condition may put this doctor at risk. So, on the contrary, Canadian Medical Association Code of Ethics and also Professionalism, and also the Code of Professional Conduct 2019 in Malaysia stated that all the medical practitioners have a duty within limits to care for their patients in any case. So, what is the limitation are these referring to? Thus, adjustment on the standard of the care provided by the medical practitioner is necessary, and it is mandatory for the related provisions to be addressed clearly regarding the foreseeable and also unforeseeable circumstances from the healthcare perspective to prevent any unwanted consequences during the pandemic crisis. So for instance, what is the issues that we always face during the pandemic crisis, such as criteria for refusal of work during the pandemic crisis, opt-in and opt-out policy, and many more. So this kind of chaotic and also tension situation among the medical practitioners not only further worsening the reputation of healthcare, but it also breaking up the public trust concurrently when the public need us the most during their most vulnerable state. Secondly, the government must take further consideration in some other social factors as well in order to obtain the mutual obligations which have been detected previously in some other pandemic crisis and also the current one in COVID-19. So for example, acceptable indemnity insurance, licensing arrangement to be offered by medical bodies or some other related bodies, priority for medical care accessibility in case they get sick during the service, such as they have this priority testing for those who develop symptoms above the community testing. Moreover, sufficient sick pay for occupationally acquired illness or burnout. Finally, consideration of wider social factors which include the employer obligations to provide childcare and some other caring responsibility in any case that the employees were sick due to the occupational acquired illness factor during the pandemic crisis. And all these are to avoid the unnecessary burden physically, psychologically, and also mentally, especially during the crucial period. The above recommendations and also criticism, we have argued that medical practitioners have a duty to participate, especially during the pandemic response, due to their special skills. But these skills actually differ from one to another, and their duties are constrained by some other competing rights as well. In special circumstances such as pandemic crisis, these obligations may be considered supererogatory. So this means that an opting-out policy based on an assessment of these competing duties, while not desirable, would be ethically justifiable. So from both the ethical and also practical viewpoint, medical practitioners must be viewed in the context of rich lives with multiple challenging demands. We should encourage them to meet the demand instead for medical aid in the pandemic, but for those who make the sacrifices and also increase efforts are all equal responsibility in return. So in conclusion, government plays a very important role in advanced crisis vigilance to achieve the equilibrium from all aspects. So settling and also adjusting the essential legislation to overcome special circumstances is crucial when mutual obligations are not met, especially during the pandemic crisis. Thank you very much.